Welcome back to Breakfast Central. Now it's time for our COVID-19 updates. According to an investigation of COVID spending in Malawi, roughly $4.7 million of the $21 million put aside to deal with the pandemic's second phase has gone missing. Now, this comes on top of $881 million from the first phase, which was found to have been spent irregularly or not accounted for by a 2020 audit.
Following the first audit, President Lazarus Chakwera promised to punish the perpetrators, and numerous officials were prosecuted, though none of the cases has yet been resolved. The current probe, a 66-page report by the country's Auditor General, details the anomalies, including undeliverable medical supplies, allowances paid without attendance sheets, and fuel purchased without proper documentation. Of course, Joe Hansen also is hanging in somewhere to quickly also share with us. It's pretty shocking.
That's true, guys. It's pretty shocking. Now, it has now been handed over to the finance minister for consideration. You wonder at times why things like these happen in Africa and other aspects, especially that which has got to do with money. Money seems to be a problem. It seems to be the bane of why many people will decide to act the way they shouldn't. In Nigeria, just a few weeks ago, just last week, we heard about the accountant general of the Federation taking some huge sums of money. And also, not too long ago, also heard of another person in office who took about 41 billion naira as well. And here we are in Kenya. Now, these are monies that are supposed to use to save lives. It rings an alarm that makes you think, is there a possibility that these ones who have taken the money can think deeply that they're taking these monies will lead to the death of many? Well, that's exactly what the story is. And Lazarus Chakwera, the president, is indeed saying that he's talking tough, by the way, that this time it's not going to be business as usual. He's looking forward to ensure that the prosecution is indeed stiff and it will go any extra length to ensure that those who are caught, perpetrators, are brought to book.
All right. Thank you very much for that update, Joe. And it is indeed important that we continue having conversations like this. We want to see punitive measures for those at the helm of affairs so we can set standards on how to act when in power. But we move over to Kenya, where the Kenyan Ministry of Health stated on Sunday that 20 more patients had tested positive for COVID-19. The latest instances come from a total of 2,219 people who were tested in the last 24 hours. The current positive rate is 0.9%. And 8 Kenyans and 12 foreigners are involved in these cases. There are 15 new male cases and 5 new female instances.
The youngest of the group is 15 years old, while the oldest is 74. There are now 324,242 confirmed positive cases in Kenya, with 3,649,319 cumulative tests completed. The health CS Mutahi Kagwe said all of this in a statement. The Health Ministry further disclosed that in terms of country distribution, Nairobi recorded 15 cases, Kiambu had 2, while Mombasa, Turkana and Meru registered 1 case each.
The Health Ministry has also revealed that 2 patients have died in the country. He explained that they were late deaths discovered after facility record audits in May 2022. Now, this brings the total number of fatalities to 5,651. 3 individuals are currently undergoing treatment in hospitals.
Well, sad story as well there, guys. And Kenya indeed is one country that has been working very, very hard to ensure that COVID-19 is indeed maintained, measured, and kept at a minimum when it comes to logistics, also when it comes to ensuring that lives are kept safe and people indeed adhere strictly to taking the COVID-19 vaccines. But let's quickly take a look at the Africa CDC updates as well. Let's bring to you updates from the Africa CDC concerning what the numbers are indeed looking like, and also let you know that in Africa, there still seems to be a lot of work to be done towards achieving herd immunity. Aside that, you also have hesitancy from persons and people who do not want to take the COVID-19 vaccine. So that's one of the biggest challenges that we're having and we're faced with here in Africa. But I can tell you this, that's all the information I do have for you here, especially concerning COVID-19 updates.
All right. Remember also that there's news reports of monkeypox also spreading across certain countries in the world, and we will be bringing you updates on that one as time passes. Now, a new study by a group of experts from the United States and Nigeria has emphasized the need of validating SARS-CoV-2 assays using locally obtained samples to determine COVID-19 exposure in the population. According to a statement released by the U.S. Embassy in Abuja, this is part of the U.S. government's ongoing support for Nigeria's household survey to identify the amount of COVID-19 transmission in the country.
The researchers used samples from COVID-19 survivors and other historical pre-pandemic samples accessible in Nigeria to validate SARS-CoV-2 assays in the lab. Now let's see what the numbers are saying so far.
All right, of course, we'll continue to give you COVID-19 updates as they come here in Nigeria and across every other country in Africa as time passes. But of course, let's stay with Breakfast Central. I was going to say something earlier about how, Africans wake up, the expectation that Africans wake up really are, with the cock crowing and the lions in the Serengeti and some of all of that. But it's not exactly that.
Well, in some parts it is.
Yeah, and I would like to have that experience.
Waking up with the cockroaches.
No, not cockroaches. I've seen that, but waking up, in some Serengeti-looking area with, animals and seeing what you have.
Yeah, lions. No, I'm being serious this time.
So jealous. I know.
Yeah,
I'm
lions.
Really jealous.
In the morning. But would you be that daring to be in the center of the jungle, to get a hotel in the center of the jungle where you can see the animals and you know that the lions are...
If every person has done it, why wouldn't I? I'll do it.
That's interesting.
Absolutely.
Okay.